Hi friends, how are you? Welcome to my YouTube channel. Today our topic is congenital heart defects. Congenital heart defect means the defect present by birth and can affect the structural of the baby's heart is known as congenital heart defects. This congenital heart defects is divided into two types: right to left shunt, left to right shunt. Today in this video we are discussing about right to left shunt. Right to left shunt means the lesion result in deoxygenated blood bypassing the lungs and being sent directly to the systemic circulation is known as right to left shunt. In this right to left shunt we have 5 diseases. First one, truncus arteriosus, transposition of great vessels, tricuspid atresia, tetralogy of Fallot, TAPVIR means total anomalous pulmonary venous return. In this right to left shunt, in babies we can observe early cyanosis. Early cyanosis means in that baby blood the oxygen content will be reduced. If you see this picture, in that baby have bluish color in fingers, toes and lips. This condition we call cyanosis. This problem we can diagnose prenatally or immediately after birth. In this condition usually required urgently surgical treatment or maintenance of PDA. PDA means patent ductus arteriosus. So, as I told you before, we are discussing these 5 diseases. So, first one, persistent truncus arteriosus. In this disease, the truncus arteriosus fails to divide pulmonary trunk and aortic trunk. Why? Because of due to lack of aorticopulmonary septum formation. In this picture, you can observe truncus arteriosus. Truncus, as I told you before, truncus arteriosus means lack of aorticopulmonary septal formation. That's why the deoxygenated blood from right ventricle to its through this abnormal septum, it enters into the left ventricle. So the deoxygenated blood mixes with oxygenated blood. Most of patients have accompanying ventricle septal defect. So these conditions will present in truncus arteriosus. Second one, transposition of great vessels. Here the aortic trunk and pulmonary trunk, it will be in transpose, means it changes their places. If you see this picture, in this picture in normal conditions the heart will be in right ventricle to it passing to the pulmonary trunk. From left ventricle to it passes to the aortic trunk. But in this defect we can observe from right ventricle to it's passing to the aortic trunk. From left ventricle to it's passing to the pulmonary trunk. This condition will present in transposition of great vessels. Normally this condition is associated with maternal diabetes. If mummy have diabetic problem means that baby have this type of problem. If you see this image, the chest x-ray, it shows the egg on a string and it narrows the mediastinum. In this TGA, without surgical intervention, many infants will die in few months of life. This is the transposition of great vessels. Third one, tricuspid atresia. First of all, we have to understand that medical language. Tricuspid means tricusp, present in right atrium, right ventricle, in between the tricuspid will be present. Here atresia will be happen. Atresia means the tricuspid is lack of formation, it not formed. So in this tricuspid atresia, because of lack of formation of tricuspid, the right atrium blood goes to the through the foramen ovale it will enters into the left atrium, then it mixing with oxygenated blood. This type of condition we can observe in tricuspid atresia. In this disease, most commonly we can observe early cyanosis. Next one, fourth one, tetralogy of folate. It is the most common cyanotic problem in children. It is mainly associated with 22q11 syndrome and also called Dye-George syndrome. This tetralogy of folate is characterized by 4 anomalies. It results from deviation of the infundibular septum in uterus. What are the 4 anomalies? First one, it is have a mnemonic PROV. P means pulmonary stenosis. Pulmonary means pulmonary trunk. Stenosis means narrowing. Next one, R. R means right ventricular hypertrophy. O means overriding aorta. V means VSD, means ventricular septal defect. If you see this picture, in this picture first of all we can observe pulmonary stenosis. In pulmonary area you can observe narrowing space. In right ventricle side you can observe right ventricular hypertrophy, means increasing size of right ventricle. Next one, overriding aorta. Fourth one, ventricular septal defect. Here in right ventricular and left ventricle, in between the ventricular septum is not formed. In this type of disease, the doctor will tell like the baby the placement of knee chest position. In that knee chest position, it increases systemic circulation. In TOF, if we can observe imaging, we can get boot shaped image like this. For treatment, we can do surgery like early surgical correction, right? Next one, fifth, TAP wear, means total anomalous pulmonary venous return. In this condition, the pulmonary veins drains into the right side of the heart, like coronary sinus or superior vena cava. Actually, in normal heart, the pulmonary veins will attach with left atrium, but because of some structural problem, the pulmonary veins will attach to the right atrium. That's why the oxygenated blood mixed with the deoxygenated blood. That's why in this child we can observe cyanosis. But this is very rare condition of the heart defect. So in this video we covered right to left shunt of congenital heart defects. If you like this video, like, share and subscribe my channel. If you have any doubts, please mention in comments. I will try to give answers. Thank you.